Today in the media conference with LAL GOEL, which is brought to you by V4 News, Global TV, V4 Stream, News Gaon Se, Malnadu TV, Samvad Sarokar News, Organ Donation India Foundation and Gyan. Our endeavor is to enlighten you about the COVID-19 impact as well as on current topics. And today our topic is COVID-19 impact on children. Every child is a different kind of flower, and all together make this world a beautiful garden. Children are the hands by which we take hold of heaven. Children are not the face of this pandemic, but they risk being among its biggest victims, as children's lives are nonetheless being changed in profound ways. And to discuss about the COVID-19 impact on children, we have a very qualified, experienced panel with us. I would like to invite my first guest, and she is Dr. Ruchire Guptha. Dr. Ruchire Guptha is MD, PG, DPN, Boston, FIAP. She is the Senior Consultant, Kailash Hospital and Heart Institute, Noida. She was the Secretary of Academic of Pediatrics, UP in 2015-16. She was Central Journal Coordinator of Indian Academy of Pediatrics Women Wing in 2015-16. She was the President of Academy of Pediatrics Noida in 2009-10. She was the Secretary of AOP Noida 2008. She is the Chief Editor, Child Today, and Official Journals of Indian Academy of Pediatrics Uttar Pradesh. She is the Technical Editor and Contributor, IAP WW Parenting Module 2020. She is the Chief Organizing Secretary, PediCon 21-22. She was the Executive Board Member, Central IAP in 2014 and 2019, and now also in 2020. She is the Core Committee Member of IAP Module on Non-Communicable and NCD. Welcome, Dr. Gupta, on our show. Dr. Gupta, please unmute yourself. As you know very well that COVID-19 has engulfed the entire world. The maximum effect is definitely on the senior citizens, then the adults, but the children's. Now, we would like to know from you the COVID-19 impact on children. Dr. Ruchire Gupta, please.
Thank you, Mr. Goel. Good morning, everybody. Dear friends, we know that the ongoing coronavirus disease 2019, that is COVID-19, spread is a public health emergency and a global threat. Governments have ordered citizens to stay at home as an emergency measure and implemented school closures to prevent further spread of infections. This we all know. As of March 26, 2020, this is the data which shows that more than 150 million children and adolescents in 165 countries were affected by school closures. Under such situations, child's total health, when I mean to say total health, mind you, it includes physical, mental, social, emotional, economical, as well as spiritual health. So child's total health has been affected in multiple dimensions. Particularly children and adolescents, lifestyle behaviors such as physical activity, sedentary behaviors may have been drastically impacted due to prolonged school closures and home confinement during COVID-19 pandemic. Basically is because of this closures and all. And the evidence is already showing the negative effects of COVID-19 and the unprecedented measures to contain it on maternal as well as child health. Now, children are at risk not only of infection, but also of losing or being separated from the family members and the caregivers. Mothers and children are affected by disruption of essential preventive and curative support and supplies, resulting from suspensions in services and transportation systems, as well as the financial constraints. Now, constrained access to clinics, schools, social workers, water, and sanitation is a particular threat to most of the vulnerable populations. Also, the lack of child protection and broader social services is particularly harmful to women and children in the need of safety. They are very much required actually. Looming above all are the concerns about the economic impact of both the pandemic control measures government are taking and the predicted knock on the effects of projected global recession. So definitely the children and their family are experiencing challenges in terms of reduced incomes, public and private debts, and reduced access to goods, which affect many aspects of household health as well as child health and nutrition. In short, these effects threaten to roll back the hard-won progress countries have made in recent decades. If I talk about total health, then let's come to physical aspects. Now, I mainly, as I have told you, that there is basically a negative impact. So if I look at the negative impact, it's a well-known fact that reduced physical activity and prolonged sedentary behavior are linked to both negative physical as well as mental health outcomes, such as loss of muscular and cardiorespiratory fitnesses, weight gain. There will be weight gain because of sedentary lifestyle, psychosocial problems, and even poor academic achievements. Furthermore, evidence also suggests that the negative impact may extend the negative impact during childhood. It may extend even up to adulthood. This trauma is going to may last longer. Nonetheless, more than 70% of 1.6 million adolescents fail to achieve sufficient physical activity globally in 2016. So see, in pre-COVID era, already, if I look at the total population of adolescents globally, which was 1.6 million, and of them around more than 70% was found to be having less sufficient or insufficient physical activity. So when I say insufficient or less sufficient activity, if somebody is having physical activity less than 30 minutes per day, it is called insufficient physical activity. If it is between 30 minutes to 60 minutes, it is called, less than 30 minutes is lack of physical activity. 30 minutes to 60 minutes is insufficient physical activity. And more than 60 minutes, that is more than 1 hour of physical activity a day, is a sufficient physical activity. So if we look at pre-COVID era, then already it was found to have more than 70% of adolescent population was not having adequate or sufficient physical activity. Now, what is going to happen in this COVID era, where there are compulsions to be at home, where this sedentary activity or this physical activity is reduced to further. See, 70% already tha, and now it would have increased to I don't know, up to 90% or what. So this is definitely an issue. Evidence also suggests that when children are out of school, for example, otherwise, like I'm not talking about COVID, these are the studies which were done when the child was holidaying during weekends and summer holidays. They are found to be physically less active and have much longer screen time, irregular sleep patterns, and less favorable diets, which result, and this will be more during COVID times, because this is a scenario which is not during weekends or holiday time, it's throughout so many months altogether. This will result in weight gain, a loss of cardiorespiratory fitness, leading to a tremendous increase in risk of non-communicable diseases. Non-communicable disease, dear friends, is again a threat. It's a silent pandemic, which is, it's going on, and we are slowly experiencing it. As this is non-communicable diseases, the problem is that a seed is sown during childhood time, and you see that fruit of that time you will see during adulthood in form of non-communicable diseases. All the changes in lifestyle, dietary behaviors, and all that kind of stuff is going to show non-communicable diseases in adults at a very young age. When I talk about non-communicable diseases, it is obesity, diabetes, that too insulin resistant diabetes, mind you, hypertension, cardiovascular diseases, and strokes, etc. And now you will, you must be listening, heart attacks at young age and all, and then you find why at such a young age. And if these things are not addressed at the right time, then risk of premature death also increases during the young age. Such negative effect on health are likely to be much worse during COVID time because of confinement at home and lack of outdoor activities. Also, the excess screen time, excess screen time, sedentary lifestyle, eating while watching the screen, all this is setting a vicious cycle on the physical health, mental health, psychological health, and ultimately reduced cognitive output. Now, if I talk about physical aspects, so not everything is bad, couple, something is positive also in this. If we want to look for the positive aspect also, since children are not going to schools or other overcrowded places like fun zones, theaters, malls, restaurants, etc., then they are less exposed to pathogenic bugs like flu and respiratory tract infections. They are eating homemade food, so less chances of typhoid fever and diarrheas. My co-panelists will definitely agree, we are not seeing that much of diarrheas, flus, respiratory infections right now, and typhoids, which we used to see during this time, ample number of cases. Now people are at home and giving attention to their home environmental hygiene, thereby less chances of getting dengue, malaria, etc. Now children are at home, so this is now parents, they can focus on their nutritional needs, so definitely a better kind of dietary environment is there. Also, people are wearing masks, the children are also wearing masks. This may lead to decrease in communicable diseases like tuberculosis, etc., which is a real threat to the globe at the global level, and more so for our country because India is endemic for this. One important aspect which we all are experiencing is that pollution level has gone up. You can see blue skies actually. So then those children who are prone to get exacerbation of asthma kind of thing or allergic problems, their incidences have also gone down. So this was all about physical aspects, positive as well as some positive as well as some negative aspects. Impact on the child's health. If I talk about mental, psychological, or emotional impact of COVID, then child and youth mental health is markedly influenced by family system, and the family interactions have been profoundly affected by this pandemic. With prolonged, and this is affected because of prolonged home confinement. The family environment may become a key risk factor for the mental health of some children and youth. Some parents are grappling with the new stresses of surviving the education and activities of their children with few external supports, while simultaneously experiencing their own economic, emotional, and social losses, as Mr. Lal has already mentioned in his introductory talk. Uh, Parents are see friends, you have to see parents are essential to buffering their child's stresses. We all know this is a part of, there's a key factor of parenting, and they have to act as a buffer to their child's stresses, helping them to manage their feelings and make sense of their own experiences. However, this buffering requires a parent who is sufficiently emotionally and physically resourced to do so. Now, in this COVID era, with the parents increasingly experiencing their own demoralizing losses, for example, lost job, death of loved ones, worsening of their own mental health, and even substance abuse, mind you, their ability to buffer their children's stresses inevitably diminishes over time, increasing the risk that the pandemic becomes, traumatic for the children and youth with enduring emotional consequences. Also, as Mr. Lal has said, that domestic violences concerns also need to be addressed and considered. If we talk about, see, when we talk about emotional impact, that is EQ. Now, there's a lot of talk about EQ. Now, perhaps a more important but easily neglected issue is the psychological impact on child and adolescent during the COVID time. Now, there are a lot many stressors on child psychological status. Stressors such as prolonged duration of this COVID, fear of infections, frustrations and boredom, inadequate information, lack of in-person contact with classmates, friends and teachers, lack of personal space at home, and family financial losses, they can have even more problematic and enduring effects on children and adolescents. So, if we look at the mental disorders or the problems, then depression and anxiety are among the most common mental disorders in children and youth, with significant functional impairment and associated risk of suicide. So otherwise also in pre-COVID area, there was a huge increase in number of adolescent suicides. Now with this time, there's so many stressors which I've mentioned, so risk of suicide may increase. Now this, the typical development and expression of mood and anxiety problems will change as the impact of COVID-19 evolves. So this is to be keep in mind. At an individual level, children and youth have suddenly lost many of activities that provide a structure, meaning, and a daily rhythm, such as school, extracurricular activities, social interactions, and the physical activity. So over a sustained period, these losses may worsen depressive symptoms and may further entrench the social withdrawal, anhedonia. You know what I mean by anhedonia? Anhedonia means whatever you do, there is lack of pleasure. Otherwise, when we do something, then one feel pleasures in doing things. But here, when people are doing something, then there is they don't feel pleasure, even if they are making art, crafts, or doing anything. They don't enjoy that pleasure. So that thing is really bad. And hopelessness, children get that they are already children are part of these disorders. So children staying at home with ample opportunity of quality, and if I look at the positive mental aspect, what it will be that children are staying at home and there is parents are getting ample opportunity, ample of providing quality time and quantity time.
Excuse me, doctor, I have to stop. I think some sound is coming from your side. Just check
Okay.
if the sound is some sound is coming, so that it is. Yeah. Yes. Please continue.
So children are staying at home and parents can provide ample opportunity of quality and quantity of time and attention to the children, thereby giving them more confidence and resilience. Coming on to social health. Now I talked about psychological, mental, emotional, and physical health. Now coming on to social health. Now we all know, dear friends, that man is a social animal. And for a positive social health, we need to meet, interact, play, socialize with the people. Now, confinement to home, not able to go to school, birthday parties, family get-togethers, missing holidaying, and missing visits to grandparents' house or nearby extended families during summer breaks. This all has badly affected the social health of child and the family as a whole. So this ultimately leads to feeling of loneliness, boredom, and isolation among children. If we look at the positive aspect, now positive impact due to busy, when the schools were open in pre-COVID time, due to busy school schedules and extracurricular activities and engagement into ample of activities, children, they were so very busy, they didn't have time since morning 7 a.m. till evening 7 a.m. And by that time, 7 p.m., they were so very tired and then they will go to sleep, right? So they were not able to interact with their near and dear ones. However, during this COVID time, there are online teaching module, online learning platform are going on. There is enough of time to interact with the people who are not living with them, to their near and dear ones, grandparents, the extended family. They can interact on social platforms like we are meeting on Zoom, Geo, Google Meets, etc., etc. So definitely, this is the time for the parents to inculcate this empathetic and concerning and caring attitude among the children, which is going to have a long-term impact. Now, coming on to economical impact. Now, as we all know, parents might have lost their jobs, they might have got their pay cuts, This, along with taking care of medical bills and ongoing household expenditures, the school fee, etc., etc., the financial health of the family is disturbed, thereby leading to direct impact on child in form of domestic violences, school dropout situations, which ultimately affect child's mental health, and this may, keep on continue even during youth period. Positive aspect, if we look at the positive aspect of of COVID on economical impact, we know that negative impacts are many, but we have to have a positive aspect, and positive mindset we will have to keep. तो हमें हर चीज में से कुछ पॉजिटिव निकालना है. So if we look at the positive aspect of economical impact of COVID, then unnecessary expenditures in form of frequent outings, restaurant eatings, traveling, schools, transport fee, spending for more of need-based item only, not for the sake of want, but for the sake of need. People are doing purchasing, and also self-help behavior. This has led to cost cutting in overall family budget. Now, the final and the important aspect is the spiritual impact on the children, the COVID, which has led to a spiritual impact. Now, COVID-19 is an era of blessing in disguise for the spiritual health, I will say, as children and family are getting ample time to practice meditation or mindfulness or white light visualization technique. This will help child and family to achieve mental peace, positive energy, and an attitude of thinking above self, gratitude, concentration, resilience. So, dear friends, in this time of stresses, it's very difficult to concentrate. But then, if we will make it a habit, it may bring definitely changes. This is what I really wanted to comment about.
Okay, thank you, Dr. Ruchire Gupta, for giving your opening remarks. And she said very clearly that the child is going to be affected, already affected, and it will be affecting further also because of this pandemic. And she has given that it is not only physical, but it's mental, social, economical, spiritual, and all aspects. She says there are many negative points, but she has also mentioned about some positive points. And the main concern is because of the pandemic, the child is confined to house, not going to school, no social activities, not going to the playgrounds. So all these things are affecting her physical health, as well as the mental and social health. And she says because of the economic problems at home, because of the job loss or the job salary cuts, that directly impact is on the child in the form of child abuse or the domestic violence and whatnot. So ultimately, the child is suffering. And she also said that this is not only last 6 months. If this will continue like this, it is going to affect when the child will become an adult, and it's a very, very far-reaching impact on the child. So it is better that we must concentrate. The parents should take care of the child and see to it that they should not have that impact where the child will have problem even when he become adult. Thank you very much, Dr. Gupta, for giving your views. Now I would like to ask Dr. Ruchire Gupta. Dr. Gupta, how serious is COVID for children? Which age group children are more likely to have serious COVID disease?
I'll say that COVID has been kind to children, but it's not like this that it's not affecting children. Earlier, we were seeing many adult population, but now, as a practicing pediatrician, I am coming across with lot many children who are also suffering with the COVID-19. So definitely, as Dr. Goel has already said, that it does not, it affects a small proportion of total population. If we talk about the proportion of illness among children and adults, and if we compare them, then it is more fatal and more serious among adolescents. And we see more cases among adolescents and as compared to younger children under 10 years of age group. Maybe because they are more confined and the adolescents, they may go out and all that kind of stuff. So diseases comparatively having, if you look at the mortality figure, then also we find that among adolescents, mortality is higher in comparison to children. Now, it's not only the disease. Sometimes there have been, diseases milder in children. Now, this milder infection, sometimes children has been exposed to once or twice with such kind of COVID infections within the family. What we are seeing the deadly problem among children is in form of MIS-C, that is multi-system inflammatory syndrome in children, or what we say hyperinflammatory response multi-system involvement. So in this, what is happening is that child is not suffering from COVID right now. He or she has suffered from COVID in the past, and because of that, that antibodies are formed, and there is an exaggerated immune response to the COVID antigen, which has led to this problem. This problem again can be deadly, not in all cases, but yes, it can be deadly, and it can present like Kawasaki disease, which is very uncommon. It's more of a vasculitis kind of febrile vasculitis kind of illness. It's more for the pediatrician. I'm talking that term, but if I look about this, then it's not only the disease per se. Sometimes the and higher hyper antibody, hyper inflammatory response to COVID in past can also lead to problems. So initially, we were having lot many reports from UK and all, America, UK, Italy, where when the peak of adults have gone down, like the curve start waning for the adult, then 4 to 6 weeks later, they started seeing their ER department was seeing a lot of children coming with Kawasaki disease or this kind of whatever the presentation which I said in which child will have fever, will have rashes, might have kidney problems, heart problems, shocks, etc., etc. So this may be complicated as well, and where we have to pick up immediately and treat immediately. Then responses are better. I also came across with 3, 4 such kind of patients recently. So uh, when it was in UK, we used to think, okay, yaar, ye to UK mein hai, humko kya? But when we and our fraternity or colleagues started seeing such kind of patients, then we said, no, it matters to us as well. So this is happening. Children, though its incidence is rare, its prevalence is less, adolescence is more, but not only disease per se, its immune response or its hyperimmune response can also pose a problem. I here also suggest to the parents or to the mothers of the children, this is the high time to inculcate responsible behavior as well as empathetic behavior among children. How can they get it? They should involve their children also into their household chores. Like if suppose they have they cook their lunch or breakfast or dinner, you just ask them to lay down it on the dining table. If she has washed the clothes, ask them to fold the clothes. You will inculcate this kind of behavior. Even suppose she has washed the vegetables, now there's no domestic help, suppose at home, she has washed the vegetables, ask him or her, be it a boy or a girl, mind you, it's important for both of them, ask them to take it out and keep it in the fridge, or maybe sort it out properly. So as a parents, Indian parents don't have a habit of involving children in their household chores. This is the problem. And that's why their husbands are also not participating in the household work. I'm telling you, this is the truth.
Uh,
So, right from the beginning, if you will inculcate this value in your children, so as an adult, they will be a different person. And this problem, which nowadays housewives are complaining, their wives won't complain. So, as a family, they will be sharing the responsibility.
Yes, I understand. Yes, true. But Dr. Gupta, the problem is with the nuclear family, when the husband wife both are working, they are working from home and they have a child of 2 or 3 years, and no nursery, no daycare, no nanny is allowed to enter in the societies. How they will take care of the child? That is a very, very challenging thing. Anyway, that is a separate discussion which we will definitely do in future. Now, my question to you is, before COVID, you all were very busy with the practice with the child and the disease of the children. Now, what happened to those non-COVID patients in last 6 months? Because of the lockdown, the patients, where the patients have gone, because after all, the first lockdown, even the hospitals were not allowed to open. And so what happened to those children during that time? Or are we still, because there are reports, the other day I did the media conference, and they says the problem is the hospitals which have become the COVID hospital, which are also doing the pediatrics and other specialty, the patients are not ready to go to that hospital. Now, that type of challenges, but ultimately those other diseases, although you mentioned that some diseases have reduced, but there are many diseases in India. What happened to those children?
So let's go one by one. Now, talking about the hospital attendance of the pediatric patients. Now, you're very right. As a parents, initially during initial lockdown, first 3 months, everybody had that kind of hover in their mind that okay, we shouldn't go to hospital, like that kind of stuff. So people were going more on to online consultations, video consultations. That platform was very, very commonly used, because for that what you require is just a smartphone. That's all. And then you can go ahead with this. And I'm really surprised to see that this platform is provided now. I'm practicing Noida, and I got a video consultation from Pune, from Mahabaleshwar. I was surprised. I mean, how come you are calling me from that distance? They said one of your patient, they are here. They were there a couple of years back, so they suggested. So now the world has become one. So anybody can use that platform. One can do video consultation, WhatsApp call. There are so many apps. One thing is this: definitely, first 3 months there was a drop down in number of consultations. Patients were very less. One is that illnesses have gone down, no doubt. The infective illnesses, even I remember pre-COVID time, during our emergency days, whenever we used to go to next day to our hospital, we used to see at least one or two patients daily with a fall, traffic accident. Now that number of now I see occasionally. So that number has reduced. Otherwise, every time our IC used to have, each day there were one or a few patients of these road traffic accident or fall injury patients. Now, second is infections are less, especially contagious diseases and communicable diseases. Yes, those long-term diseases, the chronic diseases, they're not many among children. First, I want to say so, but yes, they are there. So either they are using platform or they have taken a back seat. They were continuously using the same prescriptions for some time. But in the past 2 months or so, things have started improving. People have started coming up with this, and more messages are going of SMS, social vaccination. See, whenever this vaccine will come, COVID vaccine, it may take a couple of months, but at least social vaccination we can use right now. We can practice. We should practice. And what is social vaccination? It is SMS. If everybody uses SMS, S means sanitization, M means you wearing mask, and another S is social distancing. So see, when we have to give advices to children, it cannot be one.
Yeah.
So first is the priority should be to keep children healthy and well nourished, and taking care of vaccinations and routine checkups. Prioritize funding and support for maintaining and strengthening water, sanitation, and hygiene. This is so very important.
So today you have seen the experts' opinion, and they are worried not for present time but future, because they says that this disease definitely is less in the children, but the mental impact will be so high that once they will, after a few years or when they will become adult, they will be infected. And this can be done, solved, or can be cured right now by all of us if we will take care of their mental health. If we will see to it that if they are having any problem, we must consult immediately to the concerned doctors or the pediatrician or the mental counselor, mental health counselor. So today's program, which has been live telecasted by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon Se, Samvad Saroka News, as well as it was shown live on Facebook and YouTube.